So there's a huge amount of change going on in healthcare, and I think it's very difficult for people to keep up. And you think about some of those new technologies, people are just starting to understand what they might mean. I think people are starting to appreciate the value. Some of this stuff is real.
It's not so much delineated now as biotech, medical device, health tech, healthcare. It's all coming together as one.
The combination of wearable devices, cheap data storage, high-speed data networks and machine learning means that we're going to see a new type of personalised healthcare.
One universal system doesn't work for each individual. And that's the paradigm shift we're seeing at the moment, is that it's targeted, individualised therapies for different treatments to health.
Technology has caught up to what society needs. And so now there are investors and innovators out of those markets that are bringing new things into healthcare.
The more data that we collect, the more insights that we can glean. So it's a general statement, but the collection of data, in particular live data, can be used to really improve health outcomes across many industries.
You're going to have artificial intelligence systems in the medical service, in sports applications and in equine welfare and in the industrial sector right now. There's a bit of a mismatch on how fast this is going to come, because this is happening now.
Melbourne and Victoria have never had a better chance to be able to leverage the phenomenal opportunities that we are creating every day in our researchers and taking that to the world through startups, through creating products and services that are going to change lives and shape society into the future.
The challenge here is not one of fundamental research quality. The challenge is taking advantage of that and turning it into something useful.
We have fantastic tech entrepreneurs, we have fantastic universities and medical systems, but we can have all of the best ideas and we can have the most brilliant scientists in the world, and it actually won't amount to a huge amount unless we can commercialise that.
Working towards a goal that has both a social impact but also a commercial return. They're not mutually exclusive, and I've always believed that the NeoNav, the device, wouldn't be in the market and we won't be successful if we weren't making a commercial return for ourselves and the investors who've backed us today.
So from our perspective, that's all that matters. Are our companies better when they leave our program than they were when they came in? Do the investors like them more? Do the customers like them more? We can point to 292 commercial pilots from our companies. That's from 10 companies over less than 2 years. Those types of outcomes, they're the outcomes that we need to be encouraging. We need to be encouraging our companies to be commercial and go out and secure their next generation of business.